variants of concern represents a clear and present danger to Indigenous communities and could be devastating. As of today, in First Nations communities on reserve, we are aware of 1,174 active cases, bringing the total number of confirmed cases of COVID-19 to 23,514, there being 22,074 recoveries and tragically 266 deaths. I would like to point out that the number of active cases has been gradually decreasing over the past month. I believe that with the progress attributable to the vaccine, the tide is turning and better days do lie ahead, but we must remain vigilant to maintain this momentum. Vaccines are only one of the tools we have to fight the pandemic. To stop this pandemic, we must all use our prevention tools. Work continues with Indigenous communities and our provincial territorial partners to roll out vaccines. Overall, as of yesterday, over 200,000 doses have been administered in 586 First Nations, Inuit, and territorial communities. Starting in British Columbia, we've reached the point where at least one dose of the COVID-19 vaccine has been administered to the majority of residents in First Nation communities. In terms of the numbers of vaccinations, 30,000 doses have been administered, which accounts for approximately 54% of the adult residents on reserve. In the Yukon, 43% of the eligible population has received their first dose of the vaccine, and 25% of the population is fully vaccinated. Additionally, authorities report that there are no active cases of COVID-19 in the territory. Nunavut vaccination clinics have started in many communities such as Arctic Bay, Clyde River, and Iqaluit. There are also clinics administering second doses in Baker Lake, and Coral Harbor, and others. As of March 18th, 17,811 vaccine doses have been administered in Nunavut alone. In Alberta, Indigenous leadership continue to work tirelessly to protect their communities. I had the pleasure of meeting with the chiefs of their assembly earlier this week and will continue to work with them to address many of the challenges that COVID-19 has only exacerbated. Last week, health authorities started arranging appointments for Indigenous individuals to sign up to receive their vaccines. In Calgary, a new clinic opened to administer vaccines to Indigenous elders living in urban areas. This clinic is located in the Aboriginal Friendship Centre of Calgary, which is a trusted centre for Indigenous people for their health and community needs. Moving to Ontario, I'm very pleased to share that Operation Remote Immunity has visited all 31 remote and isolated communities to administer their first dose of the vaccine. The project was a team effort with Indigenous leadership driving the initiative with community members, Orange, and healthcare workers. All of each came together to deliver this critical service. The team has also already started administering second doses, and they expect to be complete by April. In Nova Scotia, 6 clinics in Mi'kmaq communities have administered first doses. Many federal partners, including Indigenous Services Canada, the Public Health Agency, the Canadian Armed Forces, and the RCMP, are tirelessly working with communities, provinces, and territories to respond to the community needs. Right now, the Canadian Armed Forces are currently in Matthias Coulombe, Cree Nation in Manitoba, to assist the community with their COVID-19 response, along with Canada Task Force 4, the Canadian Red Cross, and ambassadors from the Provincial Coordination Response Team. To support efforts, a liaison from my departments in the community to support with coordination efforts and to support leadership any way necessary. Over the past 2 months, members of the Canadian Rangers have worked in more than 25 communities across the Anishinaabe Nation in Northern Ontario, helping provincial authorities with tasks related to immunization. This is in addition to the 46 First Nation communities that the CAF has supported in recent months to manage COVID-19 outbreaks and facilitating vaccine distribution. Several of these communities have been severely impacted by COVID-19 outbreaks, and teams are actively working with communities to ensure essential supplies and fuel are delivered before the close of the season. As announced earlier this morning by the Prime Minister, my department and the Canadian Armed Forces will begin supporting an unparalleled accelerated vaccination program in a number of isolated First Nation communities, as well as a select number of larger Indigenous communities starting in Manitoba. We are currently working closely with public safety and the Canadian Armed Forces to expand on an accelerated vaccine rollout in First Nations communities in northern Manitoba. Over the next few days, we will be working in partnership with Indigenous leadership to assess community needs and ensure the appropriate Canadian Armed Forces resources are sent to communities requiring assistance.